Uterine fibroid embolization is a minimally invasive technique that we attempt to fix fibroids, which are smooth muscle cell tumors that arise in a woman's uterus.
Many women have uterine fibroids. They usually occur in patients ranging from the age of 20 to about 50, and most fibroids are actually asymptomatic. So patients can have these fibroids in them and they wouldn't even know that they exist.
They're benign tumors. They cause a variety of problems, including increased bleeding, bloating, pain, pain with sex. A lot of women would say that they have this overall heavy feeling in their pelvis when they have a lot of fibroids. Some women are constipated. I think the majority of women come in with bleeding problems, and that seems to be the hallmark of the disease. Women who have excessive bleeding with a normal period or bleed in between their cycles. There are a lot of alternative treatments for uterine fibroid embolization. Back in the day, gynecologists would only offer myomectomy, which is physically going in and operating on a woman's uterus and taking out the fibroid. Sometimes they offer hysterectomy, which is removing the uterus completely.
Who is an ideal candidate for a uterine fibroid embolization procedure? And the answer to that is really most women are candidates for this procedure. We use wires and small catheters the size of a spaghetti. Everything is done inside of a patient using X-ray guidance. We are able to get our catheter into the uterine artery, and we are able to inject these tiny beads into the uterine artery to cut the blood supply off to the fibroids.
It's a procedure done through a tiny incision in your wrist or your groin rather than an open procedure or a laparoscopic procedure. These are done in the office. It's very well tolerated. Patients do not need to go to the hospital. I would say the typical patient's here for about 4 to 5 hours, including all the pre-op stuff, getting the patient ready, doing the procedure, and then recovering afterwards, and they go home the same day. And we'll typically see a patient back within 2 weeks to a month following the procedure. And by then, usually a lot of the symptoms that they've had start to go away, especially the obstructive symptoms. A lot of women feel that their belly may start to shrink, that they may not be urinating as much and their constipation goes away. And it takes about, I'd say, 3 cycles for their bleeding symptoms to reach a new normal. And the symptoms typically improve over the course of a year.
Uterine artery embolization has been performed at ProHEALTH for over 5 years now. I would say over 98% of women are satisfied with their symptom relief, and even those who are not satisfied, they can always go on to a hysterectomy or a myomectomy if needed. Another benefit of uterine artery embolization is that patients can get pregnant after this procedure. If you would like to learn more about that, we will talk about that during your consultation.